Good morning, everyone. I am absolutely delighted to be introducing and chairing this session today on our during Lifelong Learning Week by Learning and Work Institute. And today is all around learning for better health. And today we are going to be exploring social prescribing, the potential of social prescribing into adult learning. This is something that Learning and Work Institute have kind of worked on for many years, and I know that there's just a huge amount happening, but it's probably a little bit under the radar actually in terms of really thinking about what the health benefits of learning throughout life can be, but also the benefits for people's lives and for work as well. We have got a really fantastic lineup of speakers today. It's going to be a pretty packed agenda. We will keep to time. The first first bit of the event, we're really going to be focused on hearing learner story and also then really hearing from NHS England and the National Academy of Social Prescribing about that wider picture and kind of what's happening and really help hopefully to set the landscape. And then we'll have a short break and a video. And then I'm so excited to be joined by a number of speakers who are really going to tell us about what's it really like on the ground. And I know that lots of people who've signed up for this webinar are from adult education. They're also from health sectors, local government and providers, lots of social prescribers as well. So we're really hoping that this is a practical and interesting event for you and really helping to go through some of the issues and also the opportunities that social prescribing into adult learning can present. So I'm going to stop there and I'm going to introduce Jackie Butterworth, who is an adult learner, who is the founder of Second Chance Astronomy and is going to be sharing her story with us today. So just a huge thank you to Jackie. Over to you.
Good morning, everybody. Thank you for having me. So I've come a long way since I was first referred to WEA back in 2019. My now ex-husband had left me and our 11-year-old son for the lady that had been cheating on behind my back. We lost our home we lived in due to the fact that I'd had to claim benefits for me and Benjamin. And the year before, I'd had major surgery to have my rectal stump removed and my stoma made permanent. If it hadn't been for my son, I wouldn't be sat here today. My life was devastated, and I was sitting in the doctors one day trying to find somewhere to help me find somewhere to live, and I came across an association called Horton Housing. So I left them a message, and a few days later they got in touch with me, and I started to work with a lady called Sarah from Horton Housing, and she mentioned to me a place called Community House where they run a drop-in called Friendship Friday, which is where I met the CEO for Up for Yorkshire and a tutor for WEA, Chris Haley Norris, and Alison Hartley, who is an advice and support officer for Up for Yorkshire. Chris mentioned that he was doing some classes with the WEA and thought it would be a good thing for me to do. So I started to do some wellbeing classes and a trauma course, which was run by Making Things Happen. I was in such a bad place. I was in such a bad place when I started to do these courses that I could not even imagine doing this talk today. I was unable to have a conversation with people, let alone think of helping others. All my life, I'd been told I was useless and a waste of space and a lot more. I've been bullied and beaten by kids in work, and worst of all, by those who are supposed to care for you. I was sexually assaulted by a teacher when I was at school, and I just never spoke about it because the first time I did, I was told it was my fault, so I just stopped speaking. And started to believe that there was something wrong with me. So it's been such a revelation to be told that I'm okay and useful. So working with the WEA and Community House, I've now started to realise that I'm good enough and can make a difference. With the help for Up for Yorkshire, I was able to set up a community group and support those who are going through the same life-changing surgery as I'd gone through, and raise much needed awareness of what it's like to live with a stoma. I recently set up a menopause drop-in to support those who are going through the perimenopause and menopause, their families, friends and carers. I now get referrals from Living Well teams, PCNs, and the hospital for both my groups. I still have to pinch myself that this is me now. I have a long way to go with my health conditions and my mental health and anxiety, but now know where to go for support. And with the friendships that I've gained over the last few years, I'm able to use what's happened to me to support others and make sure they are never left alone. WEA and Up for Yorkshire changed not just mine, but Benjamin's life as well. We are always have been and always will be a team. WEA courses change people's life and make a big difference in a safe environment. And for that, I will always be grateful.
Jackie, thank you so much. And it's always so powerful to hear people's own stories and journeys. And I know that you're going to be joining us for a couple of times throughout the session, so where people can ask questions as well. But I suppose I just wanted to kind of ask you, really, like how much in terms of so you went to this learning, you engaged. What was it that really kind of was, I suppose, was there a turning point for you, or was there a kind of moment where you could really feel that your life was changing more positively, that you were getting out of it, maybe more than you'd expected?
I think, yeah, just working with like I say, I worked with one of the WE tutors, Chris Haley Norris, and he's amazing. He makes the space safe. You know, he makes the sessions fun. You know, he's able to get out of you. You know, if you just sat there, he just has a way with being able to sort of get things out of you. Like I say, it's in a safe setting, and they're just enjoyable. And I think for me, it took a long time to be able to sort of realise that actually these people want to help me, and it's okay for me to be here and start to learn.
That's great. Thank you so much, Jackie, and for setting the scene, for sharing your own personal journey, which is incredibly powerful. And we will come back to you a few times throughout this event as well. So thank you so much.
Thank you.
Before I introduce our next speaker, I just wanted to say, I should have said that we are recording this event, but you can't see anyone in the audience, but it will just be here so that we can share it with people afterwards, and also put on our YouTube channel. And I should also say that we have a Q&A box, so there will be time to ask questions throughout the event. And so please do, if there's anything that you want to ask any of our speakers, any clarification, points, questions, comments, please do use that function, and we'll be looking at throughout the event and picking that up and sharing that with our speakers to respond as well. So I should have said that, but welcome everybody to this event, and it's very much wanting to be interactive. So I'm now going to hand over to Nicola Gitcham from NHS England. Thanks, Nicola.
Thank you, Naomi, and thank you, Jackie, for sharing your incredible journey and story. I think, you know, what you told us really sort of emphasised the need for health to have a way to connect people to community-based support that helps people to not only transform their own lives, but the lives of their families, and also the contribution that they can make to the wider community and other people who need practical social and emotional support to manage, as you were talking about, your health conditions and anxiety. And it's just an incredible way that if we don't have that relationship between when many people use the NHS when they don't use other public services, and that's why the NHS has to have this really important link to community support, and in particular opportunities to continue to learn. And I think just through my own experience, I'm the head of social prescribing at NHS England, and we've had many conversations with colleagues in the further education field over the years, and I'm always amazed at the sort of transformational opportunity that further adult learning offers us, and particularly people most at risk of health inequalities, where we know the take-up of particular further education opportunities may not be so great. So that opportunity to find your purpose, your reason for getting up in the morning, opportunity to socially connect with other people and form relationships, opportunities to learn how to manage your health and well-being, and manage and survive experiences of trauma, which are really, really important. And also to tackle particular barriers to health and well-being, such as what we might call those wider determinants, social determinants of health. And I think about some of the courses that are run around digital inclusion and enabling people to really participate. And we know that digital exclusion is much more experienced by people in some of the most deprived areas, older people, particular minority ethnic communities and inclusion health groups. So amazing opportunities really to make this connection between health and other public services and community-based support like adult learning. So thank you so much for inviting me today. I'm going to give you a little bit of an update on where we're at with social prescribing across England, and just on Lifelong Learning Week, just want to give a huge shout out and thank you to all of you that are connecting to social prescribing services and any social prescribing link workers on the call today. So if I can have the next slide, please. So what is social prescribing? So I think sometimes I always start here because I think it's very easy to get confused, and we tend to sort of extrapolate and call it everything in the community, which of course it's not. But we now have a really fantastic global definition. So there's many countries, over 30 countries now, using social prescribing to tackle inequalities and improve health and well-being across the world. And so the definition we use is it's a means of trusted individuals in clinical and community settings, so further education would count too, to identify that someone has a non-medical health related social need. So it could be housing, employment, further learning, and to connect them to non-clinical support services in the community. And that when they do that, they do it through a personalised care conversation. So it really starts with what matters to the person, looks at their whole life. So not just one element that say housing, they look at the whole thing in terms of health and well-being, and connect people up to community-based support for practical, emotional and social needs. So we can think about, in terms of adult education, some people might connect to it themselves because they might sort of think this is a really good idea, this is something I need to do, or family might have suggested it, or they might come through from the community, could be the local library, for example, or they might actually connect up through social prescribing link workers themselves who've got a bit more dedicated time to find out what really matters to people. So over the last 4 years, we've been rolling out social prescribing across England, and that has included social prescribing link workers in all primary care networks, so clusters of GP practices across the country. And the link workers, as I said, will focus on what matters to the person. They'll take a holistic view. They'll develop that person-centered plan and then connect people up to community-based support for practical, social and emotional. So it could be help with housing. It could be help with further learning. It could be connecting up to arts, sports and nature activities that are things people are interested in or want to try that are actually going to boost and help their social connection, their sense of purpose and improve their health and well-being. And so social prescribing is one of those universal targeted approaches. So it's the sort of thing that everybody should be able to access, but we should have proactive outreach approaches for social prescribing to make sure we're reaching people who benefit most, such as people in more deprived areas, experiencing health inequalities, or more at risk of loneliness and social needs that affect their health and well-being. So if I can have the next slide, please. So here's an example of social prescribing and adult learning, and a really good example on the LGA website, actually, from Brighter Futures, which was funded through the Hampshire County Council Arts Community Learning Programme and helped people and was connected up through social prescribing. And a really lovely quote here saying, "This course got me through a very difficult time, providing the help and encouragement I needed. It reconnected my passion for poetry and it inspired me to do the things that I love. Having the confidence in being able to write my own thoughts and feelings down in the form of poetry gives me a sense of relief and has enabled me to have a positive impact." So enabling people to use solutions other than medicine to improve their health and well-being, and particularly important around mental health. So if I can have the next slide, please. So why do we need social prescribing? Well, as I've said, it's a way of actually addressing social needs that people affect. And we know that over 20% of appointments in GP practices, and bear in mind that figure was pre-pandemic, are related to social needs that affect people's health and well-being. But we also know that we've got an aging population, and population that's going to have more long-term conditions, more likely to experience poverty and social isolation in the future. We've also got an increased number of health inequalities, increase in mental health, and one of the things that we know is that an estimated 10% of medicines that are prescribed in primary care are inappropriate. So not only thinking of the harm that those medicines can cause, but the cost of the NHS of prescribing things when a non-medical solution may actually have been a better way and a more effective way to improve somebody's health and well-being. So if I can have the next slide, please. So not only does it improve the health and well-being of people, their families, the communities they live in, social prescribing also supports the NHS, can reduce pressure on primary care, and with National Academy of Social Prescribing, you'll hear from Tola later, has estimated that on the basis of all the high quality studies that were done on social prescribing, our rollout of social prescribing in the NHS could result in around 4.5 million fewer GP appointments a year, and that's a 300 million cost saving a year. So many examples of how it improves outcomes, so all the health outcomes that health's interested in, and we know the connection with learning, and I think the more you can do to share the evidence with health colleagues on the benefits of adult learning, the better, and how we get that connection going with social prescribing. So if we go to the next slide, please. So a long journey since 2019. So social prescribing was always there. Adult education has always been there. I remember working with NICE in previous life. But I think what was really significant was in 2019, the NHS committed to the rollout of social prescribing across all primary care networks in England, and set an ambition of 900,000 people being referred to social prescribing by 2024, and recruiting at least 1,000 link workers by 2020-21. Now we've massively exceeded that target. We've got around 3,475 additional social prescribing link workers. So that's additional. There'll already be link workers that were commissioned by local authorities and health services, CCGs as they were. But these are additional new people into the system, attached to those primary care networks to really help connect people to community support like adult learning. And in the GP contract, we actually made sure that every primary care network has to offer a social prescribing service. They might not have a social prescribing link worker because they might have a commission service, but they have to have social prescribing offer. And Department of Health put huge resource around this, not just through the NHS with policy and funding for the additional link workers through the additional role scheme, but they also founded the National Academy of Social Prescribing. You'll hear more from Tola early on. And so various things have happened over the years, and I've mapped some of these so that you can see them. We've got a 3-year multi-region evaluation and NIHR one going on at the moment. But we've also in 2022 really developed what we call proactive or targeted outreach social prescribing. So really encouraging social prescribing services to look at population health management data, to listen to local colleagues, local communities, and actually identify who are the groups that will most benefit. So we can still take the referrals as they come in, but actually a proactive, targeted approach to really address and make sure we're reaching people most at risk of health inequalities. And so various things. And just finally, that we have got now a social prescribing national information standard. So this is a fantastic way for local services to identify who's referred and what the characteristics of people are, what social prescribing link workers refer people to, such as adult learning, and what the outcomes have been. So I really feel this is going to help in terms of evaluation of impact of social prescribing and the things we refer to in the future. So if we can go to the next slide, please. That's super. And so I'm looking forward to hearing the other presentations, really looking forward to hearing about the social prescribing and adult learning report that was done in London. I commend that to you because I think there are natural links between social prescribing and adult education and adult learning. But we absolutely have to take a strategic approach to this. We have to understand each other's worlds. We have to look at how we can make those appropriate referrals, measure the outcomes. And I had great pleasure in being able to connect up adult learning in Oxfordshire with social prescribing. And I think, just one idea I'll leave you with, some of the football clubs to help social prescribers realise the potential of what they do with community health in football services. Football clubs have had events where they've invited link workers and GPs in to learn more about the impact of what they're doing. And so just one thought to leave you with today, but thank you for inviting me.
That's brilliant. Thank you so much, Nicola. And there's so much in there. I was definitely taking lots of notes, but I know that we'll have an opportunity to come back to you in just a moment. So I'm now going to go straight on to Dr. Tola Dabiri from the National Academy of Social Prescribing, who's going to talk to us about what's happening with that important organisation and their programme. And then Tola unfortunately has to leave quite quickly, but we will have some time with Nicola and Jackie if anyone has any questions for them as well. So over to you, Tola.
Sorry, I do apologise. I couldn't get my mute or camera to work, but I'm here now. So good morning, everyone, and thank you so much, Learning Work, for inviting me to speak today. I hope I'm not going to repeat too much of what Nicola's already said. So I'll probably whiz over a few things, but I just wanted to start off by saying that I think that adult learning is extraordinarily important and transformational. I've done all of my education, including my PhD, as a very mature person. I'm not going to tell you how old I am, but I think it's very, very important. And I think I have to really admire the work that Learning Work does. I'm going to be talking about arts and culture social prescribing, which, is really an opportunity. It's almost constant opportunities to learn new things. All creative activities are learning opportunities, and it links very well with adult learning and social prescribing. So if I could have the next slide, please. So as Nicola said, that NAS, the National Academy of Social Prescribing, was formed in 2019. And our aim is to improve the quality and range of social prescribing available to people across the country. So really what this means is, in addition to working closely with health colleagues and link workers, we're looking at how we can develop opportunities for activities. For example, arts and culture, green social prescribing, physical activity, which I'll go on to talk about a bit later, but it's to make sure that there is a wide range of social prescribing opportunities available. So social prescribing is a way of connecting people to activities, information and resources to address an unmet health and wellbeing need. So Nicola gave you sort of like the global definition, which is the one obviously that we're all working to, but distilled for NASP, it means that we're connecting people to social prescribing activities. So if I could have the next slide, thank you. So NASP supports all sorts of social prescribing activities, including workplace social prescribing. So we're working with employers to develop social prescribing in the workplace. We're looking at ways of developing new approaches to social prescribing, and that's our innovation work. And we're looking at how to develop sort of like investment into social prescribing activities. A lot of the activities that link workers are referring people into are provided by VCSE organisations, but those organisations are sort of like on a bit of a hamster wheel of funding. So the long-term delivery is very often interrupted by the need to acquire more funding. So NASP is looking at how we can develop a shared investment fund, and the Power of Music is one of those that I'm going to talk on a bit later, so that we can have more sustained activities in the community for people to be referred into. So NASP also has, as well as doing all that work, NASP also has 5 specialist areas which we call pillars. So that's physical activity, the natural environment, heritage, older people, and arts and culture. And each of these 5 areas has a national lead. And as I said, I'm the national lead for arts and culture. Next slide, please. So not arts and culture at NASP. As I said, we're a very new organisation. So looking at arts and culture, we have to look at the whole of the creative health sector. As you can see, the creative health sector and referring people engaging in arts and culture activities has got a very, very long, centuries-old pedigree. It's proven to be very successful, and it's very commonly referred to as creative health. It's a very, very dynamic sector, so there's lots of stuff going on, but it's also a very uneven sector. So as I said, that's because of access to funding or to provision that can vary greatly between different areas. So my work is to try and help even that out. Arts and culture supports NASP's strategic plan. So NASP has a strategic plan as to what the organisation wants to achieve. Arts and culture supports this by gathering and disseminating evidence, very important, developing partnerships. So, for example, the Power of Music Consortium, shared investment funds, as I was just talking about. So developing a shared investment fund with money from lots of different partners going into a central pot so that people don't have to apply to lots of different areas for funding, and also the Power of Music. So the Power of Music is a shared investment fund. It's being funded by the Arts Council, the Utley Foundation, and Music for All. And the Power of Music, it came out of the Power of Music report, but the way that we're actually looking at it at the moment, and the launch that's actually happening of the Power of Music Fund today, is to support music activities for people living with dementia and to support brain health. So we know there's a lot of evidence, very, very robust evidence to say that musical interventions for people with dementia significantly reduce their need for psychoactive drugs when they're actually participating in the musical activities. Their symptoms alleviate quite considerably. So the Power of Music is to try and support increased investment into music for dementia activities across the country. We're looking at connection, as Nicola was saying, sort of like it's very important that the health service actually manages to connect with communities in a variety of ways. So NASP is looking at how we can develop a whole community system to make this easier. And NASP also, one of our strategic aims is to raise the profile of social prescribing. And I do that. I support NASP by speaking at events like this, finding case studies, and commissioning videos. Next slide, please. So my role, as I said, it can be summarised as developing strategic interventions and access to arts and culture and creative health through social prescribing. Next slide, please. So the long-term aim for creative health must be to move arts and culture away from nice to have to essential to health and well-being. There's a perception that arts and culture activities are enjoyable, that they're fun, but they aren't really supportive of health. They aren't really supportive of well-being. They're more diversionary activities while the real work goes on somewhere else. But this isn't the case. Arts and culture activities, sorry, could you go back, please? Sorry. Arts and culture activities support mental and physical health in many ways. Now we can go to the examples. So singing and music, as I was just talking about the Power of Music, singing and music alleviates symptoms of dementia. It can be used to treat postnatal depression and to improve respiratory conditions, for example, long COVID or asthma. Dancing, another arts and culture activity, can be used for falls prevention and to alleviate symptoms of diseases like Parkinson's. And knitting, something a bit more crafty, can be used to alleviate the symptoms of arthritis and to treat depression. Those are just a few examples, and I'm actually working on a grid which is like links arts and culture activities with the long-term conditions. So there's a lot more evidence out there. If you have the next slide, please. And if you like to find out more from our rapid evidence review, if you go to the NAS website and go to evidence, there's the rapid evidence review that was published last December for arts and culture. And there's a lot more information about the evidence about how arts and culture and creativity support mental and physical health. Next slide, please. So in my work at NASP in the past year, I joined in September 2022. And as I said, it's a very dynamic and uneven sector. So I spent a lot of time mapping and seeing what's happening and where NASP can make a difference. And the priorities that have emerged over this time have been working with libraries to increase arts and culture, social prescribing and social prescribing activities in libraries and delivered by libraries, and information about social prescribing available in libraries. So libraries have been seen as very key because they've got direct links to people in the community. They're seen as neutral spaces, and lots of people will probably go to a library who may not go to other places in the community to get their information. I've been working with partners. It's a wonderful sector to work in, and there's some amazing organisations delivering creative health, such as National Centre for Creative Health, the Culture, Health and Wellbeing Alliance, and London Arts and Health. And there's some fantastic work going on in areas which can be referred to as creative health zones. For example, Greater Manchester, which is the world's first creative health city. There's lots of fantastic work going on in Manchester to address unmet health needs through creative activities. So working with partners has been very rewarding, and it actually allows NASP to amplify its works. Okay, thank you. I've got my 2-minute warning, so I better hurry up. Working with greater integration with colleagues across NASP. So for example, there's dancing is also physical activity, and it's also arts and culture. It could take place outside, which means it would be green social prescribing. And if it happened with older people, it would be social prescribing for older people. And in a historic building, then that would actually be working with heritage as well. It's quite a flippant example, but there are examples of how we in NAS can work in a much less siloed way to actually help increase opportunities for social prescribing in ways that people will want to take part in. And horizon scanning, which is looking at future opportunities, for example, increasing opportunities for dance and working with museums in the way that we're working with libraries. So next slide, please. So there, I think I finished on time. I'm sorry that I won't be able to stay for questions, but please do contact me. My email is there, toladebiri@nas.info, and I'm sure that Learning and Work would be happy to pass on my contact details. If you would like to have some more information about NASP, then our website is socialprescribingacademy.org.uk. So thank you very much indeed.
Thank you very much, Tola. That was great. I know you need to run, but there was one quick question which just said, could you recap what the 5 pillars were, which I think came up in your presentation? I wonder if you had a minute to say that.
I have. Just to explain, I have to go to London and then to Darlington today, so I'm on the train. So the pillars are physical activity, natural environment, heritage, oh now you've got me, older people, and arts and culture. Those are the 5 pillars. But if you go to the NASP website, then all of the information about NASP is there.
That's fantastic. Thank you so much. Really, really appreciate it. And
thank you.
That's brilliant. I hope you make all of your other meetings today. Thank you.
Thank you very much.
Thank you. So I know that Nicola Gitcham also needs to kind of dash off from this section quite soon. So please do, if you have got any questions, please do kind of put them in the chat now. I had a couple of questions for you, Nicola. I hope that's okay.
Yeah, sure.
So you spoke a bit about outcomes and evaluation, which I just think is so important. It was really great to hear of the work that's going on to do some of more of that monitoring work. And I guess that's partly when I'm sort of talking to people about social prescribing, quite often the sort of questions are, well, does it work? What's the impact? What's the evidence base? And then the kind of, you need to have things to socially prescribe into. And then also kind of, how do people navigate the system? And I know that those are all areas that you're kind of looking at. And I just wondered whether you had reflections on kind of, has the, NHS England has been so behind this and has clearly driven it. It's just amazing that exceeding its own targets. Just really thinking about, what is most important kind of coming next. So in terms of that evidence base, are there many people that still need to be convinced about this, or kind of, actually is the evidence base for impact, I think, quite good yet. And also just thinking about funding, to touch on some of Tola's points about kind of short versus long-term funding. Obviously, some of the things that people socially prescribe into in terms of community learning or community groups, are under pressure in terms of funding. So what does it look like out there from your perspective in terms of both? Sorry, that was quite a long rambling question, but really in terms of sort of evidence, but also funding. I wonder if you could pick up on that.
You have to tell me if I've missed anything, Naomi. I think the honest answer is it's variable. There's I think it's only 2019 since we've been rolling this out, and actually that's quite not very long in something that's so transformative in the way that the health system works, but also requires massive interagency support. So social prescribing is something that's quite interesting. I think it's got quite a lot of cross-government support. You have DEFRA, who's interested in it because of nature. You'll have DWP because of employment, DCMS because of the arts and culture, as well as Department for Health and Social Care. So it's I often think it's quite a sticky issue. It attracts a lot of people because they can come together and do some of the things that they've wanted to do, which is making sure we can connect people to activities to promote health and well-being, further learning, and tackle social determinants of health. But the rollout is variable. So in some areas, very mature, and they have good strategic partnerships between, say, education and health and other parts, and the VCSE. And they're looking at how they sort of develop more sustainable approaches to this. In other places, you might just have one link worker attached to a primary care network. So I think and you've got this report coming later, which I think is really good, from London. But the important thing is how do you start to have a more strategic conversation with health partners around what are the health needs of our local population? There are obviously key major ones that we would expect. You think about something like pulmonary disease or cardiovascular disease or asthma in children, mental health. There's some big ones that we're aware of. But each sort of local authority sort of footprint, if you like, within these big integrated care systems, will have particular issues that they need to address or that they're concerned about. They'll also have intelligence on health inequalities. It won't be perfect, because we know for people with health inequalities, such as people who are homeless or Gypsy Roma travellers, for example, often missing from those data sets, which is why you need your community insights as well. But I think it's strategically, how can you have that conversation about what's the need here and how could we work together to deliver something? Funding for social prescribing link workers on the whole has come through the NHS because it's the way to connect to community. But funding for community-based activities, such as Tola was talking about, needs a variety of different funding sources. And I think that's it's holistic approach to health and wellbeing. So it requires a cross-government approach. So we should be looking at what's coming down that we can connect up, but also looking at what these big arm's length bodies like the Arts Council, like Natural England, like Sport England can bring to the table in terms of what their priorities are and are matched, sort of getting that shared leadership for social prescribing. So I think on a strategic level, there's quite a lot we can do. and how will we measure outcomes? How could we use the information standard, for example? But then on a real local level, if I was a local social prescribing link worker, it's reaching out, isn't it, to your further educators? How do you find the person to have the conversation with, to understand what the offer is, so you can really turbocharge the reach? And anything people can do to build that connection strategically on a practical level with social prescribing is really important.
Thanks, Nicola. We've got a couple of questions through from the audience.
Okay.
I think the first one follows directly on from what you were just saying. So this is from Vanda de Freitas in Blackpool Council, who says that they're delivering IPS employment support across Lancashire and South Cumbria, integrated with their primary care networks, and think that social prescribers will be their key referrers. But how do they find the social prescribing lead for Lancashire and South Cumbria integrated with Care Board, so they can start to have those conversations?
Very, very good question. I mean, you can always write directly to the integrated care system, can't you, to say, how do I find out? You know, I think that's important, to sort of be able to even send things up. That raises the profile of social prescribing. You can contact your primary care networks. So, you know, who often your practice managers will know where there are what social prescribing looks like for their local area. In some places like London, they've actually got a social prescribing interactive map. So you can find social prescribing services and social prescribing activities. I mean, that's the sort of thing that would be fantastic if we can start to do at scale. But there's just some examples, I think, of where you could start. Very good. Great to see IPS being rolled out.
Definitely. And thanks. I'm having a look. So also just to sort of say to colleagues as well, that in the kind of, we're going to, after this bit, we'll take a short break, and then we're going to come back and we've got some really fantastic presentations, people who are working on the ground as well. So we'll be talking about how they've made approaches and built relationships as well. So I'm hoping that should be really helpful as well.
And Naomi, I think it's worth being aware, you know, when I talk to social prescribing link workers, particularly now, often the biggest issues that they're facing, that people are experiencing, it's poverty, it's cost of living challenges. And so being recognizing that they are digital exclusion, housing, food, you know, so all of the sorts of things that you can think that lean into those social determinants that you offer, I think are really, really, really important. And sometimes those basic needs need to be addressed first before people can look at some of the more longer term things like learning. But so I think it's how you set it within that context, how you frame it is really, really helpful, because sometimes people go to further education because there's a course that's going to help them with an area that they're concerned about, but then actually enjoy it and go on to something else. So I think it's how we get that hook in. And also thinking, you know, when you have talking to population health management leads in integrated care systems, you know, what are the needs and what's the local offer? So the shared investment plans that Tola talked about, we're working with National Academy of Social Prescribing on those. But where they've set those up, they're really, really powerful, because they actually have identified some key needs and inequalities they want to tackle in a local area. And then you get some funding from health, from the local authority, possibly public health, charitable funding, philanthropic funding. And actually sometimes they're set up in a way to even attract corporate social prescribing funding. So you start to build a bigger pot to tackle sort of shared priorities and needs. And I think that's got a lot of legs.
That's brilliant. And can I just ask one more question, because there's a few things coming through about funding, but I also think some of those around relationship building can be picked up at our second panel as well. Just around, there are a couple of questions around funding, which I think flow from what you were just saying around opportunities potentially for, could there be doing more around kind of joint budget sharing across health and education? I don't know if that's something that you've seen before in terms of across sectors, and also kind of funding where Jamie from Cornwall is saying that actually sometimes due to the geography and so on, you're only going to get small numbers of people, but the social prescribing into learning can make all the difference for them in their lives, but it's very hard to fund low numbers of people as well. So there's something there around kind of the opportunities potentially for working across different funding streams in order to fund what's needed.
Mixed funding models. I mean, I think there's no doubt, Naomi, that there is pressure on budgets across all parts of the system, and there is pressure of demand across all parts of the system. And I think, but there is money in the system. So we have to somehow try and get together to agree some shared priorities and how we make that happen. I haven't come across joint funding. It's not to say that it's not happening, but I think that would be a really interesting area to explore. And you might want to talk to the National Academy of Social Prescribing about when they get when they're scoping these shared investment funds, how adult learning could be part of the consideration. So I think that's a sort of practical sort of way that you might want to have a look at it.
That's brilliant. Thank you.
And integrated care systems are very different. You know, you look at somewhere like Gloucestershire. Gloucestershire has funded some amazing arts prescription work to tackle areas where people are experiencing long-term conditions like chronic pain, you know. So be interesting to look at some of these leading ICSs, integrated care systems. So going to the National Centre for Creative Health, which Tola mentioned, would also be a good link, I think, to talk to.
That's really helpful. Thank you so much, Nicola. And just on the creative health piece, I found that really inspiring when Tola was talking. And in fact, because it's Lifelong Learning Week, we're exploring lots of different things throughout the week. And yesterday, we published an open letter from a number of very prominent artists and actors and writers and colleges as well, talking about how opportunities for going into learning around kind of art, culture, into the creative sectors are limited, partly to do with funding, partly to do with other opportunities, but also talking about the benefits for health and well-being of those sectors. So I think there is a real kind of groundswell now for that recognition of the importance of that creative health piece as well. And that's something that I know that we're
and we probably talk about 4 pillars of social prescribing. So we talk about the sectors. So we talk about arts, and we probably say arts and heritage, but you know, arts and heritage. So you could have arts, you could have heritage. We talk about nature, sports, but then we talk about social determinants of health, you know, sort of social economic support, like your CA, Citizens Advice Bureau, that sort of thing. And then we'll talk about it across a lifespan. So for right from birth through to old age. So yeah.
That's brilliant. Well, I just want to say thank you to you again. Thank you so much to Jackie. And we'll bring Jackie
back
as well.
Yeah, I really took so much from what you were talking about, and really exciting to hear how all those groups are setting up and how you're supporting other people to live with their health conditions. So yeah, thank you for everything you're doing.
Oh, thank you.
Okay. And Jackie will bring you back in for the discussion a bit later as well. Okay. On that note, we are going to take just a 5-minute comfort break because we like our health and well-being. So go and grab a cup of tea, or we're also going to show a short video as well. So do hang around for that. I'll try and make tea and watch a video at the same time. We will come back at 5 to 11 for a action-packed second part of this event, where we're really looking at systems and what's actually really happening on the ground. Thank you so much. Hello, welcome back everyone. I hope everyone managed to take a short break. We have got a pretty action-packed second half of this event. So I am really delighted to welcome Victoria Bourne and Claire Hilton from Kingston. If I can welcome you here and then hand to, can I hand to Victoria? Can you do some introductions? That'd be fantastic, thank you.
Sorry, me to do introductions.
Oh, yes, yeah, if you'd like to
Sorry,
introduce
yeah,
yourself, sorry.
yeah, okay, yes, sorry, I'm Vicky Bourne. I'm a wellbeing tutor from Kingston Adult Education, and I shall leave it to Claire to introduce herself.
Hi there, I'm Claire Fielden. I'm a social prescriber in Kingston upon Thames. I'm based at the GP surgery. Here we are in the GP surgery. Yeah, I've been doing the job for just over 2 years. And yeah, Vicky and I enjoy a really good relationship together. Looking after our mutual patients, clients, customers, whatever you'd like to call them.
Yeah.
That's brilliant. Thank you very much. So I've got a few questions for both of you, and definitely would love to kind of have this as a conversation. And again, I know that you'll be happy to sort of take any questions as well from our audience as well. But we're just so pleased to have the both of you here, because I think what's really exciting about this particular event is that we're trying to explore perspectives from all the different kind of angles and sectors as well. And both of you are working absolutely kind of on the front line of this stuff. So really, really excited to hear more about your really brilliant work, which I've been really impressed by in the kind of all doing all the preparation for this event. Just absolutely blown away really by what you're doing around Kingston. So super excited for you to be sharing that. I wonder if you could just, both of you, just briefly describe your roles, kind of what does the day look like for you both, as a wellbeing tutor, but also as a social prescriber?
Shall I go first?
Yes,
Yeah.
please.
Okay, I run one particular course which is called Practical Ideas for Happier Living. So that runs, it's a 6 weeks course and it runs every half term. I absolutely love running this course. It's something I feel really passionate about. It's free. It seems to make a real difference to people's lives. Not only does it have so many fantastic practical tips, but it also allows people to get to know other people in a similar situation, make great relationships, support each other. We have a laugh, we learn lots of stuff, and you know, we pool all our experiences and resources together. So it's a fantastic course. I can say it because I didn't write it. I just run it. But every single time I go, I learn so much myself, as well as hopefully other people having a lot of stuff to take away as well. So yeah, that's me. And as I say, I really can't say enough about the kind of joy and pleasure that teaching this course gives me.
And Vicky, can I just ask you, what skills do you bring to the role? Like, where have you come from? Like, how did you get to this point where you're writing?
Okay, yeah, I'm a counsellor and a social worker by background. I also work for the local Mind in Kingston. That's sort of my more full-time job, but I work for Kingston Adult Education as well, and they really complement each other so well. So when I'm running the courses, I can also refer people on to a lot of other things that we provide, as well as additional mental health support and that kind of thing.
Great, thank you. And Claire, what's your background, Claire, and how have you got into this, and what does a day in your working life look like?
So last century, I worked in travel and brand management and marketing, and this more recently, shall we say, yeah, I've been in property and tenant management, house renovation, but as Vicky knows, I've always been quite a nosy Parker, I suppose. I'm quite a good networker. So I've got a great memory for what people get up to in the local community. And one of my friends is a GP, and she said, "Oh, you'd be really good at this job. It's just sort of emerging." And I took about a year to sort of think, well, you know, shall I? And I am really enjoying it. I'm part-time. I'm employed directly by the GP surgery. I see a wealth of problems. Some people have just run out of steam. Some people have much more profound, difficult issues that we aim to help and support with. Yeah, that's me.
That's brilliant. What an interesting background sort of taking you to what you're doing now, as well. Vicky, could you tell us a little bit more about the detail of the course that you mentioned around practical ideas for happy living?
Yes, as I said, it's a 6-week course, and it focuses on a different subject every week. So on week number 1, we look at gratitude. We have a thing called 3 good things a day, where no matter what kind of a day people have had, that they try and focus on 3 good things, however small, to feel grateful or happy about. And that's a skill that we take forward into the whole of the course and try and make that a lifelong skill. So changing your way of looking at things and trying to look for the good in every day when sometimes everything can seem so bleak and negative. But we also have a session on resilience. We have a session on setting goals for yourself. We have a session on mindfulness and looking at trying out new things, what we can go on to next, new skills, and also looking at things that we enjoyed when we were younger and might have put aside and we might like to revisit. So, nearly everything we look at is free. And it's just things that are around you and making use of your community and just trying, as I say, to change your mental attitude to how you see things, and with the support of other people as well. That becomes very powerful.
And is this quite a unique course, or have you seen sort of similar type courses, the same course run in different places?
It's all based, it came initially from Action for Happiness, if people have heard of that, which obviously is a much bigger movement. It has its own website and runs a lot of courses. Ours is an adapted version of that, but as I say, we're able to run it for free with some funding, outside funding, which is just really helpful for people. So, it's just an amazing offer to have locally, I think. And also, as I say, encourages people to go on and try other things and look at different aspects of adult education that they might not have looked at before. We very much, we give people a little kind of report at the end of a personal learning plan, and the little report at the end of the sessions too. So they have something to take away with them and feel that they've really achieved something over the 6 weeks.
And that plan, is that kind of, what does that look like for people? Is that kind of their outcomes, like what they might want to do next, like what they've achieved, or is it a kind of more of a kind of where they might go and giving some advice?
Yeah, it's reflective on what they have achieved so far. So they've got a little record of that they can take away and look back on. And it's also, they might have discussed things that they might like to do, computing, or some people want to improve their English as well, maths, that kind of thing, or go on and just do a photography course or something else. So we can have other tutors come in and talk a bit about those as well, and can certainly connect them up with other people. So in that way, it's just the start, hopefully, of a whole new education journey.
That sounds brilliant. Claire, can I just ask you, so we've said some really good things about it, but why do you refer people onto the course? And I suppose, is there a kind of, when someone's coming to you, is there a particular kind of person or someone with a particular background that you think might particularly benefit from this course?
No, this course is for anybody at any stage of their life. The NHS have a really great article called 5 Steps to Mental Wellbeing, and I quite often will talk to people about 5 Steps to Mental Wellbeing, and it fits very nicely with the course that Kingston Adult Education offer. So for those of you who are not familiar with that article, we'll put the I'm sure we can put the link in the chat, but it's about connecting with other people, being physically active, learning new skills, giving to others, and paying attention to the present moment. So mindfulness, essentially. So practical ideas for happier living, a free course offered by Kingston Adult Education, seemed to fit very nicely. I got to know Vicky quite well. It's really nice for me to talk about her personally. I wanted, it's a face-to-face course, which was unusual to be offered when I 2 years ago. I wanted my patients to meet somebody who was friendly and would offer, a sort of a structured course around what I was interested in them learning about. So all of those 5 points are all met in Vicky's course. Sorry, it is Vicky's course. In practical ideas for happier living. So and it was free, and people not only learn new skills, but they're also learning about themselves. They're learning. They're meeting new people. I think some people have gone on and carried on meeting up. It's taken them to a different area of Kingston. I think people are more observant when they go into a different setting. So Vicky's course is based at a GP surgery. They will pay more attention to the posters in that surgery than they will in my surgery. I know this because we've got another patient who's doing some exercise classes at the library, and he's noticed there's a chess club advertised on the notice board. So he's all of a sudden, just because we've got him to go to one course, it's led to a chess club, and there are some new chess boards. I don't know if you've seen them, Vicky, in the local park that they've put up, sort of stone chess boards, and he's going to go and take his set and ask one of his friends, and they're going to have a little, a fair weather chess match. So it's kind of gone in a different direction, but just getting people to get out and meet people and expand their mindsets has been really, really beneficial. I even said to somebody, they were talking about exercise, and I said, well, get the bus to the course, and then walk back a couple of stops. That's your exercise. You've got your steps in, and jump back on the bus back into Kingston. So yeah, it's a great course. There are lots of great courses offered by Kingston Adult Education around anxiety, around children's health, digital inclusion, and lots of them are free or low cost, reasonable costs. There's a mindful movement on a Friday morning that's free for 6 weeks. There are lots of things that people can sort of filter into, having done practical ideas for happier living. So yeah, we're really lucky in Kingston, and Vicky and the other tutors and the admin staff are really supportive of my patients. I'm going to be late, I can't fill in the form. Whoever's done the recruitment for Kingston Adult Education has done a brilliant job at finding the right people to talk to my patients. That I constantly get amazing feedback about them, and some of them I've now met in person, but I developed these relationships mainly through just ringing them up. Sometimes you have to ring up and not email. You just have to hear somebody's voice on the end of the phone, and you get a quicker answer. And I think it's more, it's been beneficial to our relationships. And my relationship with Kingston Adult Education in particular. Does that help?
Yeah, absolutely it does. And I think that you touched on so many things just then. So absolutely the partnerships, and we'd love to hear a bit more about that, because I know that some of the a lot of the people on this call and who've also signed up who'll watch online later are from the kind of health and education sectors, and actually saying, well, how do we join up and how do we build those relationships? So I think that's really important. And the other pieces that you touched on around this is about mental health, but it's also about learning, and then it's also about physical health as well. So kind of building all of that in, and the point of social prescribing is to help to improve health outcomes, but in a non-medical or alongside a medical kind of pathway as well. So it sounds like from everything you've said that that's really what's happening from your perspective.
I mean, practical ideas for happier living will help someone's demeanour so they can go on and feel better about tackling their housing problem. Perhaps, it might give them that little bit of space to think, right, okay, I've done my mindfulness. I learned that from practical ideas for happier living. It's really stressful. I'm going to remember that. That's square breathing. That I learned, they're skills for life that they're learning.
And Vicky, can you tell us about the impacts? So do we have evidence for kind of outcomes and impacts beyond the kind of people sort of saying it? Do we have any kind of data?
Yeah, I mean, since 2016, which is when we started this course, and I think I was involved right from the beginning, we've had over 3,000 people enroll on this particular course. And to give an idea of retention and achievement in the past 3 years, the overall retention has been 91% and the overall achievement is 89%. And when you take into account, you know, these are mental well-being courses targeted at those who have mild to moderate mental health difficulties, committing and attending courses is not always easy for people. So I think we do pretty well to make it seem a kind of really safe and inclusive space for people, and somewhere they want to come back.
That's brilliant, thank you. And then I think kind of the last question from me, but I know that you're going to come back and join our panel afterwards, is Claire, you've obviously spoken about it already, but really about that partnership working between adult education and social prescribing. Really looking for some tips from you, practical tips of how to create strong and sustainable partnerships. And I mean, I guess really interesting, Vicky, from your perspective, like you're working on health issues, how easy has it been to connect in with the health service in order to kind of make all this happen?
Yeah, I'm going to be honest here and say that I did know Claire before. I knew what a positive person she was. I knew that we just shared the same philosophy. We've never really talked about it, but I think we come from a really similar place of just really wanting, you know, to help people in a very practical sense. And so I knew that was going to work well. But having said that, I do work with other social prescribers who I didn't know before. And I just think, you know, I've taken an interest in it. I think it's just an amazing thing to offer. And, you know, I'd say that, yeah, you've got to get to know the person, you've got to network, you need to get to know the social prescriber themselves as well and have a relationship with them. And then you learn to trust each other and they send people your way. And, you know, so you've got to build that relationship as well. I think that's really important. So spend some time on that.
Yeah, I think that's really important. Put the email down and pick up the phone or go rounds. I met Nick Ward from Kingston Adult Education in the Hook Library. But I'd been talking to him on the email for ages. Yeah, just, you know, get out there, take your patients along to some of these events that are on. But equally, social prescribing can just be a supportive chat, I think, as well. Not, you know, and that's the starting point. It's a supportive chat, and then hopefully, I describe myself as a professional nudger sometimes. So I'm nudging people along. I'm selling. I'm not telling. Yeah.
Brilliant. Thank you both so much. That was a really fascinating insight into how things are really working in Kingston and the benefits of that cross-sector working, which is definitely having an impact. I just want to say thank you very much, you two. We will bring you back. And so again, if anyone's got any kind of thoughts or questions specifically, then do please put them in the Q&A and we will come back to those. So thank you so much to both of you for now. And then I'm very happy to introduce our next speakers and presentation. So we are joined by the brilliant performing medicine, Carly Annabelle Coop, who is then going to introduce Catherine Peters afterwards, I think. So Carly, over to you.
Hello, I think Catherine's going to be introduced first.
Hello, everybody. Yes, just very briefly, thank you so much to Naomi and Catherine for inviting us. You know, we're delighted to be here today. I will briefly tell you about Performing Medicine, who we are, and I'll hand over to Carly Annabelle Coop. But we are an initiative, part of an organisation called Claude Ensemble, a performing arts organisation. And Performing Medicine has for over 2 decades been providing healthcare education using practices drawn from theatre, dance, visual arts. And we're aimed at training programmes, professional development that help anyone working in this field to gain a deeper understanding of how they care for themselves, their patients, their colleagues. So ultimately, it's about improving compassionate quality care for all. And we've been working obviously in medical schools with NHS trusts, but with this growing interest in cultural social prescribing, we have been very focused on cross-sector workforce and the upskilling of understanding and people within cultural social prescribing. So I'll hand over to the designer and deliverer of our cultural social prescribing workforce development program, Carly Annabel Coop.
Thanks, Catherine. So I want to just share with you the work that we've been doing very much on the ground, and our experience of leading a workforce development programme on social prescribing of arts and culture. We've been working across a number of London and London boroughs. So we've been training and networking with artists and arts organisations, and joining and linking them with social prescribers and link workers around exploring what is cultural social prescribing. We've brought together artists and social prescribers together, and I think there's in terms of a system approach, really for us is actually the need for cross-sector working to ensure that kind of integrated approach to prescribing arts and culture. And the main purpose of this work is about building understandings. So Nicola mentioned about getting to know, understand each other's worlds. That's been really at the kind of art of this programme, about connecting, building local networks, and looking at the potential for collaboration. And what we found in terms of what works is that you need a kind of system to do this, and through a training and network program of work, which is essentially about creating space, holding space for people to spend time, to connect, to explore, to talk to each other, and build those connections around that. The big aim around this programme was to look at how arts and culture, as Tola mentioned, it is one of the pillars of the national social prescribing, but how it could be understood within the context of social prescribing in a particular local area. So, putting together what already exists in terms of mechanisms or processes, resources, what are the kind of potential kind of opportunities for people to work together. And essentially to devise that cross-sector approach, allowing the different sectors, so that's arts and health, to connect, develop and understand each other's worlds, and start to learn how they can communicate effectively and begin to think how they can work together. So the training programme and networking programme that we delivered in local boroughs was spending time to create a process for arts and arts organisations and link workers to learn, explore and connect together. So within that piece of work, we looked at for everyone to really explore what arts and culture is and its possible benefits to social prescribing. We also found it useful to introduce a framework to help articulate the ways that arts and culture may support health and well-being via social prescribing, and I'm going to talk a bit more about that in a moment. Sharing case studies of arts and cultural projects, so inspiring and building the kind of knowledge of what's possible. And another useful thing was for the arts and arts organisations to start to explore how do they communicate and articulate the work that they're already doing, so the kind of offers out there. And for those link workers and social prescribers to build confidence in terms of talking about arts and culture to their clients, the individuals that they're working with, and the impacts that these can have on health and the well-being of both individuals and communities. And then I think the heart of this programme is around making connections. So as part of this training programme, there is a whole networking event for the artists and arts organisation, link workers, social prescribers, the health sector to come together, learn together, and also kind of appreciate the different worlds that they're operating with. Can I have the next slide? So I just want to share with you this particular pie chart. So in the training, there's lots of different levels and knowledge of expertise. So some people, like the artists and arts organisations, that's what they do. They're very familiar with arts and culture. For some of us, they might know very little about it. So what does arts and culture mean or kind of look like? So I think what we've started to do is to kind of break down really simply, like, what does it look like? What are the kind of art forms or activities around that? As Tola mentioned, there's a long history of the health benefits and the well-being benefits of arts and cultural kind of projects. But what we found working with link workers is what does arts and culture means? What are the kind of some of the assumptions or perceptions around that? And one of the questions we asked our link workers was around, what does arts and culture mean to you? What things bring you joy? And actually, a lot of the link workers already started to talk about things that they did for themselves or activities. So like singing or dancing in their kitchen with their children, or reading or drawing or going outside, painting something. So without the link workers realizing, they were already doing lots of arts and culture, perhaps without kind of thinking about it or realizing it within this way. So I think this is really useful to start to open up awareness and understanding, so that for the link workers to know that arts could be for everyone, and there's different ways of engaging in that. So for us here, thinking about the language and unpicking what arts and culture activity is, and to break it down really simply of all the different aspects of it has been really important. If I could have the next slide. And then something that's been I would say quite pivotal in our training is, again, breaking down the perceptions of things and where does arts and culture kind of fit. When we were developing the training, we spoke to lots of link workers and also GPs in the scoping and the design, and many referred to this to Maslow's hierarchy of needs, and I'm sure you'll be kind of familiar with this. And Nicola earlier talked as well about, you know, people really focusing on these kind of basic needs, and yeah, we see it kind of arranging the social, physiological and biological aspects of health and well-being in a hierarchy, with the most fundamental needs at the bottom exerting the strongest influence. The idea that if you have to address these lowest needs first before you can move up the pyramid. And in social prescribing, what we found is often these lower needs are prioritized. The belief that if these needs are satisfied before addressing, they have to be satisfied before addressing some of the other needs. And they may have needs around particular kinds of types of challenges or issues, such as kind of housing, for instance, which would be there at that kind of physiological need. There's sometimes an assumption that arts and cultural activities only address the higher needs when the lower ones have been met. So we kind of challenge this, which is, so is this idea of a hierarchy of needs actually true? And in short, no. We think, you know, it's a very outdated model created in 1946, and there's no evidence that needs exist in a hierarchy at all. And research shows that whilst needs are universal, the order in which these needs are met has little impact on people's satisfaction with life. In fact, supporting some of the higher needs on the pyramid can lead to cascade effects that can help support those lower ones. And also, we all look for meaning, even when we have more basic needs like food or shelter. Maslow's model is also very individualistic, forgetting that we live within a community and relate to others. So that, if I could have the next slide, please. So what we did is we reimagined a new framework of needs to kind of challenge Maslow's hierarchy. So these categories might be understood as feeding into each other in a multi-directional circle. So where addressing one need can have an influence on another and vice versa. So this new way of looking at how needs can be met incorporates what we know about cultural and arts activities, and the fact that engaging in these can help us meet many of our needs. These can then feed into others, causing a kind of knock-on effect, a chain of influence. In turn, this helps improve our health and well-being and feelings of connection with the communities around us. So going back to what we know about arts and cultural activities, we can begin to visualize that arts and cultural activities could in fact support many of these needs at the same time, which then all support each other. So for example, going along to a singing group can increase a person's confidence and self-esteem. Instead of being a person with a health challenge, they can identify perhaps as a singer and feel accomplished. This can encourage them to try more activities that connect them with others, reducing feelings of isolation and low mood. And you know, the talk earlier with Vicky and Claire talked about, you know, doing that course may then help them with those kind of unlocking or unpicking some of their kind of housing needs. So not to just solely focus on kind of basic needs. And this was really a great way for link workers and artists to understand each other's worlds, but also for the link workers to kind of open up and become aware of what else could they focus on to empower and improve somebody's in life. And one of our link workers, one of her clients and individuals she was working with, had a terrible housing issue that couldn't be achieved in the kind of overnight or in the short term. So again, exploring what else mattered to her, she found that her client was really interested in photography. So supporting that person to do a photography course, to go outside, to take pictures. Even though the housing crisis couldn't be kind of sorted immediately, it empowered that individual in lots of meaningful and different ways for them. And then again, I think networking for us is as an opportunity for the artists and the link workers to connect, a chance to explore how they can work together, to understand what each other are doing, what are the kind of needs in the local area, and how this might move forward, and discuss some kind of collaborative approaches. So creating a space to build relationships and connections and for people to work together. And then I think some of the themes coming out of the programme, if we just go to the next slide, is for both the artists and link workers to really appreciate or look at the value of arts. And I think this is quite typical of the work that we've been doing. Is one of our link workers said, I've developed my understanding of the connection between arts and culture and social prescribing. I've learned that in my role supporting people facing deprivation and very challenging needs. However, it's important to look beyond supporting their basic needs and support them holistically, how prescribing arts and culture activities can make a meaningful kind of change. So not to just solely focus on those kind of more basic needs, which Maslow does within the hierarchy. And then if we move to the next slide, things around connecting. And I think this is the essence of getting cultural support, social prescribing working on the ground, is for people to connect and talk to each other. And yeah, for instance, the link worker, I think this is, you know, I think I'd written off these sorts of arts groups for some individuals before these sessions. It has made me rethink and reflect on lots of people who I've missed an opportunity to refer out to such groups so far. And then finally, I think if we have the next slide, language. When we're working from two different kind of sectors, one the arts sector and one the health sector, how for artists, how are they communicating what it is that they're doing, and also for them to build their knowledge and understanding of social prescribing, and also to come together to share their practice with others as well. And to, I would say our big takeaways for our training and networking program on cultural social prescribing is about a cross-sector approach really designed to nurture relationships, broaden understanding, encourage discussion across health and arts sectors, and primarily facilitating connections between the sectors that meet local need. And for people to learn together, connect with people is a really essential component as a first step to build further and build on those relationships. So for us, if you're going to get arts and culture working within the local areas, people really need to understand it, and we need to know who the link workers are and build those relationships, have them in the room to connect together. Thank you.
That's brilliant. Thank you so much, and exactly to time as well. So extra points as well. But that's so interesting. The work that you're doing and really kind of breaking down that idea of need and really focusing on kind of what's going to work for people. I just think is so interesting. Thank you very much. Well, there is definitely lots of food for thought there. I'm going to ask Alex Stevenson to come in now and present, looking particularly at the work that Learning Work has been doing, did in partnership with the Greater London Authority in London. And then we will have time to come back to kind of bring all of our speakers back for questions, discussion as well. So now I'm going to hand over to you, Alex. Over to you.
Thanks, Naomi. Good morning, everybody. So I'm going to talk a bit about some work that we've been doing on social prescribing and adult education in London. And I guess we've heard a bit already this morning from Nicola about the health policy context that's enabling more work to be done on social prescribing. And this is more in the context of adult education and skills policy. And I think the big development here that's enabled more of a focus on social prescribing to take place is the devolution of the adult education budget in areas like London and other mayoral combined authorities. And certainly things like the Skills for London strategy and roadmap are providing a bit more of an opportunity to think about the role of learning for health as well as for other outcomes of learning like employment and progression in work. So if I can have the next slide, please. I'll just go through the aims and objectives of the project quickly. We were commissioned by the Greater London Authority to carry out a mapping exercise of social prescribing to adult education and improve Londoners' mental health and well-being, and also to develop a toolkit of effective practices, which I'll come on to a bit later on. The aim was really to develop a better understanding of how adult learning can join up with social prescribing and increase the responsiveness of adult education provision in London to Londoners' health and well-being needs. So in order to do this work, we undertook a desk-based review. We engaged with 35 stakeholders in in-depth interviews. We'd ran a number of stakeholder workshops, which engaged a further 30 participants in 5 sessions. And we also spoke to adult learners themselves, as well as people who were not currently engaged in learning, but may have been in scope to benefit from an adult education offer. And if you can nudge the slides on a little bit, some of the key research questions that we had there focused on how Londoners are referred to adult education opportunities, and how effective those referrals are, and to what extent are they supported following those referrals, the impact of COVID on social prescription to adult education, and what can we do to improve referrals, and what can the GLA do to support that. This is a project that took place in late 2021 and into early 2022. So the COVID context is particularly relevant, as it provided an opportunity, I think, to really highlight the role that social prescribing to adult education could play in meeting some of those needs and challenges that were made particularly visible by the coronavirus pandemic. If I can have the next slide, please. So just to run through the main findings of this piece of research, and I think we've heard a lot on this from other speakers in the call already, but we did concur that there is significant potential for a wider rollout of social prescribing to adult education across London to improve mental health. And there is a good evidence base there. In context of COVID particularly, many social prescribers and adult education services were anticipating an increase in demand for their services as a result of the pandemic. And this was seen as something that could be potentially valuable to reduce dependence on primary care. In the context of the pandemic, some social prescribing services were new, and it was particularly urgent because there was a need to address things like the need for food and medication. So that did inform a big part of the sense that there was a role for this, but also that some of the priorities were around more urgent needs like food and medication. So there was that sense that there was a bit of a missed opportunity where adult education could do things like provide some of that really vital contact and connection with others, as we've also heard from some of the others on the call. The second main finding was that it is really difficult to understand the impact of social prescribing to adult education, and that's because there is a lack of comparable quantitative data on things like how many people benefit, what kinds of benefits are observed, and challenges in monitoring outcomes, because there isn't a standard way to do that, and there is a lack of data sharing infrastructure amongst the different stakeholders involved. And social prescribers and adult education providers have different kind of metrics and different drivers within their own systems of funding and performance management and evaluation. That means that really to get that picture of impact, there's more to do to coordinate that. Our third finding is that there is a lack of strategic coordination between social prescribers and adult education providers. This is inconsistent or underdeveloped across London. So whilst there are some brilliant examples, as we've heard from in Kingston, for example, that is not the case in every London borough. So referring to adult education in particular can often be relatively low down on the priorities of social prescribers, and there was a lack of understanding about what adult education could offer despite its potential, and sometimes it's just not that easy to find information. So some of the main databases used by social prescribers don't include information about local adult education opportunities. And whilst there is a better connection between stakeholders in some boroughs, most stakeholders don't have an established network where they can share information between the different partners, promote their services to one another, and discuss ways in which they can collaborate and improve their services. And finally, so the adult education budget itself was identified as lacking a clear priority for the delivery of learning for health and well-being. So though it's mentioned in various strategies and policies, adult education providers told us that they really wanted to deliver learning provision aimed at improving health and well-being, but they had capacity constraints in doing so within their funding allocations. So some of them told us that if they wanted to do more on health, they would maybe need to do less on another aspect of learning provision, and they weren't quite sure how to prioritize that. There was also a need within providers to build capacity in terms of their staff skill sets to deliver this kind of learning and to undertake the kind of partnership working that we've heard about in Kingston. And so we did feel overall that there was a need to set a clearer commissioning priority. If I can have the next slide, please, I'll just run very quickly through our recommendations. So they mainly followed on from those findings that we felt that the GLA could do more to promote and raise awareness of adult education as something that benefits health and well-being. Things like the Mayor of London Adult Learning Awards are a really good example of ways in which that could be done. I've talked about setting that priority for the delivery of learning for health and well-being. Also, there is, as we've discussed, more to be done on developing standardised approaches to the monitoring of referrals and measuring the outcomes, and there is a need to address that issue of systems leadership and developing strategic partnership working. Just a final word to finish off with on the toolkit that we developed as part of the project. So this is intended to be very practical. We'll be sharing the link for this after the webinar today, I'm sure, but it covers some of the evidence base, information about social prescribing for those who are maybe more on the adult education side, and vice versa on adult education for those who are working on social prescribing. And we include a number of practical kind of tips and examples and case studies around a systems approach to building partnerships and overcoming some of those challenges around data sharing and outcomes monitoring. So as I say, we'll be sharing the link to that and also to the report following this session so that you can have a look at that in more detail. So I think that is everything for now. I'll hand back to Naomi. Thank you.
That's brilliant. Thanks, Alex. And I know that when we've been talking about this and talking about the toolkit and our findings as well, which we'll obviously share with people at this event and afterwards as well, that we've also had really good conversations with other local authorities, combined authorities as well, who I know are really interested in understanding what the picture's like, where the barriers might be, and what provisions actually happening at the moment and how they can extend it as well. So I think that's really good. Can I ask all of our panelists to put their cameras on? We do have about 10 minutes for questions. And we'll have a whole kind of, we've got a few in the chat box. Please do add any more in if you'd like to. I just wondered, first of all, I'm just quite interested to hear from you all about whether there's something that somebody else has said that has really resonated with you, or that you particularly would like to pick up, or that you found surprising or different. And Jackie, I don't want to put you on the spot, but I wondered, given that we haven't heard from you since, it feels like a long time ago now, since the beginning of this event, but from your perspective as a learner and someone who's gone on to create their own business and courses and engaging others as well, is there anything that you particularly have found interesting or surprising, or just kind of as reflected on your own experience that you've heard from many of our speakers?
It's just lovely to hear that that more people are able to do it, and yeah, go on and do the stuff like I did when I first started doing WEA.
Right. Thank you. And I just wondered, is there anything else that any of the panelists have heard from a different organisation or a different speaker that has kind of really resonated with you, or that you thought was kind of interesting to pick up? Claire? Oh, sorry, you're on mute.
Sorry. It was the lady. She seems to have disappeared. It wasn't Catherine. It was yes, it was Carly. Carly, I love the fact your talk about the music. What I liked was the fact that people could define themselves not as homeless or an ex-manager or unemployed, but they could define themselves as a dancer, and I really, or a musician, and I really like that. And I saw that with my husband when he was feeling a bit down. He'll love me for telling you that. But I saw him. We went to some music concert, and I saw him, and it was a retro thing, and I saw him extract the energy. It took him back to a place in his life where he was really happy, and he seemed to extract the energy out of that memory, and he came out of there completely revitalized, and so that reminded me of that. And also, sorry, I'm being greedy, Alex. I don't have very good connections with the university in Kingston, but I have really good connections with the Kingston College and Kingston Adult Education. But university, don't seem to be that available. Have you got any tips for me?
I think that was a question that was asked earlier in the
yes, it was, yeah.
The scope of our work was around adult education budget provision, so that isn't typically delivered by higher education institutions. So in the context of this report, we can't unfortunately shed any light on that, but perhaps there are others on the call who can.
Yeah, let's come to that one. But Kylie, can I bring you in first?
Yeah, I was just really inspired by Claire and Vicky's kind of relationship with each other, and that's what it for us is really about in the work that we've been doing in the workforce development around. And I think you said it lots of times, Claire, around, you can send lots of emails, but you might not get the kind of responses, but actually picking up the phone or talking to each other or connecting and seeing each other in person, or going along and trying out kind of new things so that you really understand, and then you can share that with the people that you're working with. And I think that's what we found really works on our programs when you've got artists and arts organizations. They've been trying you know, for ages to try and contact their social prescribing leads, but they haven't kind of got responses. Put them in a room together, then they can talk, they can kind of connect. And I think that is a real important kind of first step. So yeah, I thought your relationship building together, brilliant.
Thank you. Yeah, I think in some ways this will echo what Collie's just said, but when I heard you, Claire and Vicky, talk about the work in Kingston, it felt like a fantastic example of what we are aiming to do through our workforce development, or collaborative workforce development and networking. And as Collie says, that the sort of benefits of working at a local level, so the understanding by the artists and the arts organizations who attend the training and networking of the particular health priorities or community needs. All those voices are represented in the room, and it gets rid of what we often hear from artists, particularly freelance artists, working on their own projects, who have fantastic ideas, but actually no one's really spoken to them about what's needed where they are, or what's going to work where they are. So I loved hearing about the places you'd both come from, and it was basically from an understanding of your own community and experience within that. So yeah, it's a fantastic case study which we might build into our training, I think.
Thank you, Catherine. Vicky.
Yes, not so much a question, but a comment on that. I mean, I'm a user of Kingston Adult Education myself. I do a course which I absolutely love, been doing it for years. So that's a thing that I think is really important too. If people have time to go on a course as well as social prescribers, I know that is a time thing, but there's nothing like a personal recommendation, is there? And, even if it's just a short thing, to have plucked up the courage to go into that room yourself and see what it's like and see what you get from it. Can mean an awful lot. And I just wanted to comment how moving I found Jackie speaking at the start, and that could have been the story of so many people as well that have come along to some of our courses, and it's just so wonderful to hear how much you've achieved, Jackie, and what you're doing now. So many congratulations and huge admiration from me.
Thank you.
And I think the point around kind of actually trying things out, so kind of breaking down the barriers and increasing knowledge, it has to be really important. So interesting. I wonder how many, for example, so some of the people that we've been speaking to are just like brilliant people who are commissioning social prescribing, looking really interested in skills and adult education. And I'm just wondering whether also for them, they're not link workers, but they are actually the commissioners, whether taking on some courses and trialing some of these things as well actually could be a benefit as well, just so that it's part of that breaking down barriers, isn't it? One question that I don't know if anybody on this is going to be able to answer, but it is around the higher education point. We did have somebody who asked earlier, Charlotte, sorry, I don't know where you're from, Charlotte, but we'd just love to know more about the potential role of higher education supporting this work. And I don't know whether anyone's got any particular reflections on that. Yes, Catherine, and then Claire. Thank you.
Sorry, Naomi, my hand went up earlier actually, rather than in.
Oh, sorry. Okay, well, you contribute now, and then we'll come to Claire on the higher education, if that's okay.
Sure. Yeah, it was really just in response to your point about commissioners, that as our workforce, our cross-sector workforce development has developed, we've begun to invite commissioners along to the networking events, and we often kick off with a Q&A where they're very, very much engaged, and it's all geared towards establishing a sort of truly effective network from the offing. So we like as you've implied there, see the commissioners as part of this collaboration.
Yeah, that's really great to hear. Thanks, Catherine. And Claire.
I was going to just this is a completely random comment, actually. I'll come back to adult uni education and tertiary education in a minute, but we need to help people realise that there is help in the community. We need to up the social prescribing profile. Now, when I was in Birmingham, I was doing a master's degree, and one of the mechanisms they used to up Birmingham's profile was that they had a little kids program called Brum. I don't know if you remember it, but the whole point was that Brum drove around Birmingham and showed everybody what was on. And you know that famous soap called EastEnders. Well, there used to be a Dr. Legg. So could we have a social prescriber pop up in EastEnders, because there are apparently lots of people in EastEnders that have various issues. Can we go big? Why not? I don't know, but and just on the uni education, I've got a couple of sons, and some of them are at uni, and they would really benefit from hearing about 5 steps to mental well-being. They would really benefit from practical ideas for happier living. That the suicide rates at universities are going up. There is a lot of self-neglect in that population, and it just goes unregistered. It goes under the radar. And what I notice about the mental health provision there is it's all on the internet. It's all fill in this form. It's all email us. You're in a queue. There isn't somebody that goes around and bangs on doors, or we haven't seen you. You swipe in, swipe out. Well, if somebody hasn't swiped in or swiped out, well, where are they? Why are they not leaving their room? So I think there are obvious places that universities could support with. Okay, I'll leave you with that.
That's great, thanks, Claire. Another question, someone, Angela, asked a specific question around the kind of breakdown between men and women on the on Vicky's course. So it'd be helpful if you had that data. But I suppose just a wider point to anybody who wanted to answer is, and there's something that Nicola brought up, so as the potential for social prescribing to maybe reach people who might have sort of fallen through the gaps of the system, for tackling kind of wider inequalities as well. And are we seeing, are you seeing a really good diverse mix of people being socially prescribed, or is there more to do, I suppose? So I think that's a specific men and women question for Vicky, but then kind of any reflections on the potential for social prescribing to tackle kind of inequality.
Yes, it's probably not going to surprise you that I'm going to say vastly more women than men, but we do have men. And I remember one particular course, and Claire certainly referred a very memorable man to this course who got an awful lot out of it. I think he'd left school at, he hadn't been going to school since he was about 10. He was living on a boat, really kind of different kind of life, but very unconnected. And he got so much out of the course. He loved it. And there was another man, luckily, on that course, and he knew about the local man shed, and he got involved in that, and they made a great relationship. So I think many more women than men, but when men do come, often they're made a big fuss of just because they're unusual as well. But I think they get an awful lot out of it, and can connect with other men, which they don't always find easy, and hopefully lead on to other things as well. So we need more men, because it does them so much good, and so many of them are very lonely and leading very lonely and isolated lives.
That's really important. Thanks, Vicky. Anybody want to come in on the kind of wider inequalities points? If not, what I will say is that Learning and Work Institute has been working this field for quite a long time, and I was just talking to just sort of messaging Alex earlier saying, we should probably share our briefing publicly, actually, which just talks about some of the evidence base around learning, the opportunity, the potential for adult learning to help to tackle inequalities and health inequalities as well. So there is a bit of an evidence base already, but I think there's, in my summary, I think there's definitely a lot more to do as well, but we'll happily share that. So on that moment, I'm just going to say thank you so much for all of our panelists, our contributors, and you've made this an incredibly rich event. There's a huge amount of information. Just one thing for us and everybody on the call before you dial out. Just in terms of adult learning, we are going to try a quick online poll to get your views on this event, a sort of quick evaluation. It's adult learning because we have just tried, it's the first time we're trying to use Mentimeter polling via Zoom, so it may or may not work. But if I could ask my colleague Helen to start the Mentimeter poll. It's 3 very short questions, and we would be very grateful if people, panelists and attendees, would bear with us and see if we can get this to work. So you go to either on your phone or on your computer, you go to menti.com, that's menti.com, and then put in the code 24353187, and you'll get asked 3 short questions. And this is going to help us to understand how we might take this event forward. And if it works, some of the answers should start pinging up on the screen.
Can you repeat the code?
Yes, the code is 24353187. I can't see any answers. Yeah, obviously this may or may not be working. Oh, here we go. Wonderful. That's great. And that's wonderful. Oh, we've got a beautiful word cloud coming up. And then, presenter, can you show the next slide? We're just wondering whether we can go on to the next question. Ah, excellent. And then, so we just want to know kind of what one thing would you take away from this event? It should pop up on your screen. That's great. And then just in the last moment, we're going to do one more quick one. Oh, that's brilliant. And we're going to collect all of these as well. And then what one action would you take after this event? And do you need any help from us? Fantastic. Just as people are filling in their last questions, again, just wanted to say thank you so much again for our contributors. Thank you so much for joining this event. As mentioned, we recorded it, we're going online, we'll put it on our YouTube channel. We're also going to be sharing resources and links, and I think we can share the presentation slides. We just need to double check with our speakers, and we'll send out an email, electronic communication to everybody who registered for this event as well. Please do take a look at Lifelong Learning Week to see what else is coming up this week and do get involved. And again, thank you so much. It's been great to see you, and it is 12 on the dot, so I am going to close this meeting. Thanks again.